بسم الله الرحمن الرحيم. المحاضرة اليوم هي عن Radiology of obstetrics and gynecology. ونبدأ بالobstetrics. The first question is what is the role of ultrasound in the first trimester of pregnancy? Few points about the role of ultrasound in the first trimester. أولا, detection of non-viable pregnancy. يعني differentiation between viable pregnancy and non-viable pregnancy. non-viable pregnancy لها many causes. ممكن يكون blighted ovum, يعني gestational sac without fetus, without fetal pole, أو ممكن missed abortion، أو ممكن incomplete abortion، أو intrauterine death. فهذه كلها ممكن نشوفها وأن can be diagnosed by ultrasound in the first trimester. هذا نشوف هنا هو gestational sac which is empty, no fetal ball. This is blighted ovum which is an unviable pregnancy. The other point here, detection of ectopic pregnancy. Ectopic pregnancy عادة تصير thick wall cystic mass beside the ovary. This is the ovary, or this is thick wall cystic mass. طبعا إذا بالدوبلر راح نشوف peripheral vascularity. This is example of ectopic pregnancy. Points الأخرى هي to assess the gestational sac. To assess the gestational sac. عادة نستخدم بالفيرست trimester crown rump length. The crown rump length. This is example of crown rump length from the crown to the rump. Frequently used in the first trimester. The other point is to determine the number of embryos. يعني this is example of twin pregnancy. This is example of twin pregnancy. 2 gestational sacs with 2 fetal poles. Other point, to detect relevant maternal abnormalities مثل fibroids أو ovarian cyst أو pelvic masses. هذه كلها ممكن نشوفها. وهذه example. This is pregnancy and this is fibroid. This is the cervix. There is a fibroid beside the gestational sac. Other point is يعني from the roles of ultrasound in the first trimester is to assess the nuchal translucency. Nuchal translucency. We have a picture here. To assess the nuchal translucency, and you can see it here in this picture, which is the nuchal translucency is thin fluid band at the back of the neck of the fetus. When it is thickened, it is usually associated with chromosomal disorders خاصة Down syndrome. فهذه تقاس بالفيرست trimester between 10 to 13 weeks, which is strongly associated with chromosomal disorders خاصة Down syndrome. You can see now this thin band of fluid. This is normal nuchal translucency. If it is thickened, usually associated with chromosomal disorders. So these are the points or the points of roles of ultrasound in the first trimester. Now, the second trimester ultrasound وهو عادة يسمى the routine scan لأنه إذا in the first trimester the patient is asymptomatic, you don't need to do ultrasound. The routine scan is usually at 18 to 20 weeks of gestation. The routine second trimester ultrasound obstetrical scan. Why it is done at 18 to 20 weeks? Because it provides, at this age, it provides accurate dating, يعني accurate assessment of gestational age, and it's great for assessment of the fetal morphology, يعني detection of fetal anomalies. So what are the roles of ultrasound in the second trimester? يعني the same مثل ما قلنا راح نشوف number of fetuses يعني twin pregnancy, triple pregnancy, assessment of gestational age عادة نقيس biparietal diameter. This is example of biparietal, how it is measured the biparietal diameter, or assessment of the femoral length. You can see this is the femoral length assessment to detect the gestational age. Other point is the position of the placenta to detect placenta previa. To detect the placenta previa. This is an example of this is the placenta, the echogenic placenta. This is the cervix, and the placenta is covering the cervical os. So it is placenta previa. And it is important to assess the Likert volume. You can detect oligohydramnios, like this fetus. You see the uterus is collapsed over the fetus, no fluid surrounding the fetus, severe oligohydramnios, or polyhydramnios, excessive fluid around the fetus. And of course, we can detect fetal anomalies. So these are the points representing the role of ultrasound in the second trimester, which is usually the routine obstetrical scan. In the third trimester, it's not routine to take ultrasound in the third trimester, but it is indicated in some cases, and these are follow-up of placenta previa. If you see placenta previa, you should follow up the placenta previa, because most of the cases of placenta previa which are diagnosed at the routine scan will resolve later in the pregnancy. So you need to follow up the placenta previa. The other indication, follow-up of fetal abnormality. If you see fetal abnormality like mild hydrocephalus, you need to follow up this abnormality. And you should do ultrasound in the third trimester if you have a suspicion of growth retardation. Other indication is maternal diabetes. And other indication is guidance of amniocentesis or other interventions to the fetus at the third trimester. So these are the points of roles of ultrasound in the first, second, and third trimester. Now, ultrasound in gynecology. طبعا ultrasound is the primary investigation of choice for assessment of gynecological disorders. شلون يجي presentation؟ ممكن تجي as a feeling of pelvic mass، ممكن تجي bleeding، ممكن تجي painful cycle، ممكن تجي postmenopausal bleeding، وهكذا. هذه اليوجوال، أو ممكن تجي infertility. هذه هي اليوجوال presentations اللي which are indications for ultrasound in gynecology. عندنا two types of ultrasound اللي نسويه بالultrasound، يا اما trans abdominal أو trans vaginal. شنو الفروقات بينهم والadvantages والdisadvantages؟ trans abdominal requires a full bladder, which is a disadvantage. You need a full bladder to visualize, يعني to use the bladder as a caustic window to the pelvic organs. لأنه إذا the bladder is not full, the bowel loops full the pelvis وبعدين gases, it might be difficult to assess the pelvic organs. Trans abdominal من الادفانتجز مالتها انه wide field of view. You can freely assess the pelvic cavity وحتى الابdominal cavity. If related, you see pelvic mass, you need to assess the liver وغيرها. field of view كبير، يعني large field of view, you have a freedom to assess the whole pelvic cavity and abdominal cavity. بينما transvaginal limited field of view, very limited field of view to the uterus and surrounding areas. The transvaginal, الادفانتج مالته it uses high frequency probes. احنا نعرف بالالتراساوند كل ما يزيد الفريكونسي كل ما الريزولوشن اعلى، وبعدين الترانسفاجينال يعطيك ريزولوشن أعلى. ونعرف أيضا بالألترا ساوند فيزيكس أنه كل ما زاد الفريكونسي كل ما قل البنتريشن، لذلك هو الفيلد أوف فيو ليميتد. field of view limited يعني you can assess uterus ovaries but you cannot completely assess the pelvic cavity. This is a major limitation, is the small field of view for transvaginal ultrasound. Other disadvantage, it might be uncomfortable for the patient. Otherwise, it is better to do transvaginal ultrasound for early pregnancy up to 11 to 12 weeks. It's better to assess the early pregnancy and the gynecological problems by transvaginal ultrasound. الأوفاريان masses ممكن يعني الأكثر the most common is the simple ovarian cyst. Simple ovarian. This is a picture of simple ovarian cyst. شنو الفيتشرز of simple ovarian cyst؟ الsimple ovarian cyst هو unilocular thin walled anechoic. هذه هي الفيتشرز of simple ovarian cyst. إذا هذه الفيتشرز ما موجودة يعني مو unilocular septated multilocular أو مو thin wall يعني يصير thick walled أو be solid component أو be septations fine or thick septations أو be echogenic fluid، هذه كلها نسميها complex ovarian cyst. Okay, so this is example of simple ovarian cyst, unilocular, thin-walled, no septation, no solid component. What is the definition of complex ovarian cyst? Complex ovarian cyst. طبعا complex ovarian cyst ممكن يكون definition مالته واسع، ممكن يكون hemorrhagic cyst اللي يصير ب internal echoes، ممكن يكون ectopic pregnancy مثل ما اللي هو thick walled مثل عادة يعني internal echoes و thick walled و vascularity بالبريفري. ممكن يكون كارسينوما ovarian carcinoma cyst adenocarcinoma مثلا. ممكن يكون اندومتريوما أيضا تجي as complex ovarian cyst. ممكن تجي as dermoid which is mature cystic teratoma اللي تحتوي على فات. وممكن as abscess tubo ovarian abscess. فهذا مثلا complex ovarian cyst the above one contains thick and fine septations multilocular. This one is also you see a solid component projecting into the lumen of the cyst. So these are complex ovarian cysts. This is example of dermoid. You see a ball of fat within the cyst, echogenic fat floating within the cyst. Ultrasound might not be able to differentiate these causes: tumor, hemorrhagic cyst, endometriomas, dermoid. So the powerful tool to characterize ovarian tumors is MRI. Okay. So ultrasound is very powerful tool وأحيانا كثيرة تغني عن غيرها بالgynecological disorders، بس لكن نحتاج في حالات كثيرة إلى MRI for characterization of ovarian masses. يعني إذا نأخذ هسه فكرة عن investigations أو radiological tools اللي تستخدم بالgynecology، حكينا على الرول of ultrasound والتايبس مالته. البلين فيلم مثلا plain X-ray almost has no significant role. ممكن detection of calcification أو يعني بس almost has no significant role. أكو الهيستروسالبنجوغرافي HSP hysterosalpingography، هذه عادة indication مالتها نشوف بالمريضات with recurrent abortion أو infertility. ليش؟ indicated لأنه هي الوحيدة اللي can detect the patency of the tubes, fallopian tubes, tubal patency. It can assess the tubal patency, and it's useful in assessment of the shape of the uterine cavity. the shape of the uterine cavity يعني variants and congenital anomalies of the uterus اللي يسوي ممكن recurrent abortion. فهذه هي فوائد ال HSP hysterosalpingography. شلون نسوي ال HSP؟ يعني contrast catheter عن طريق catheter وكونتراست يندفع into the uterine cavity under guidance of fluoroscopy. اكو شبيه لها يسمونها السونو HSP سونو هيستروسالبينغوغرافي. هذه ايضا كاثيتر لكن ندفع يا اما التراساوند كونتراست وتتبعها under guidance of ultrasound مو فلوروسكوبي under guidance of ultrasound. تدفع كونتراست into the uterine cavity او تدفع سيلاين ممكن وتتبع الفلويد باي ultrasound under guidance of ultrasound. وهي استخداماتها نفس ال HSP لكن ال HSP is more sensitive is better in assessment than sonohysterography. Another CT scan. A CT scan can characterize some ovarian masses ممكن ولكنه المين رول هو staging of malignancies لأنه assessment freely can easily assess all abdominal cavity والبريتونيوم والأومنتم والليفر وغيرها in single scan. وبعدين هو it's very important in staging of malignancy سواء uterine, cervical malignancy or ovarian malignancy. Sometimes it can characterize some ovarian masses but not like MRI. CT scan is very poor in differentiation or in the assessment of the uterus and the uterine masses, very poor. While MRI very powerful in characterization of ovarian masses, very powerful in assessment of the uterine variants and anomalies, where it's good for assessment, or it's great in assessment of local tumor extension in the pelvic cavity. So it's a very powerful tool in gynecology, يعني هاي اللي قلنا الديفينيشن مال pelvic masses كل الامراي يقدر يميز لك الدرمويد عن الكارسينوما عن الاندومتريوما عن الابسس عن الاكتوبيك. هاي كلها الامراي is very powerful in differentiation of these differential diagnoses. So this is a brief idea about the imaging tools in gynecology and obstetrics and the role of ultrasound in obstetrics. وشكرا جزيلا.